great. So look, the webinar this morning is about the submission of the private supply returns for 2023, and we'll touch a bit on the monitoring program aspect, some of the updates from the new regs as well. So I'll go through some of the introductory slides, and then Derval is going to come in a little bit about local authority roles and responsibility, and Rory will then do a demo on the EDEN system. So sorry, that's the running order there. So again, as I said, I'll touch on the EPA role in drinking water quality. I'll give you a bit of a rundown on the private supply report from 2022 and some of the key messages and actions out of that. Then I'll hand over to Derval, who'll go through some of the local authority roles and responsibilities. Now, I suppose it's not an exhaustive list of the regs, but it's just some of the key ones that we feel should be brought out. And then I'll hand over to Rory for the bulk of the presentation, which will be a live demo of the EDEN system, from how to get your supplies uploaded to EDEN, to assigning monitoring results to those supplies and submitting those to the EPA for the annual return. We'll take a bit of a break about 12 o'clock. If there's a natural break kind of in Rory's session around about that time, we'll take a break. We'll go back to Rory then, and we'll have about 20 minutes then at the end for questions, and I'll turn off the recording at that point. So the role of the EPA then, really, we're the regulator for the public water supplies, so those operated by Uisce Éireann, and that's under the new drinking water regs SI 99 of 2023. So Uisce Éireann report exceedances and incidents into us, and we follow up and investigate those to ensure that the water quality has been restored. We can carry out audits as part of those investigations, but we also do a number of proactive audits throughout the year, just looking at treatment processes, that ensuring that they're adequate for the supply and that management systems are adequate. If we do find supplies then that where treatment systems maybe aren't as we would like to see, we can add those supplies to our remedial action list, and they'll be prioritised by Uisce Éireann for investment. We publish a number of reports and advice and guidance. The first one is our annual drinking water report on public water supplies, and we really use this report to kind of drive our strategic enforcement objectives. So looking at things like the National Lead Programme, National THM compliance, the disinfection programme, things like that. We publish all of our audit reports online as well. They're on the EPA website. We have a huge amount of advice and guidance, which I'll go into a bit more detail there on the next slide. And we can take enforcement action, obviously, in the form of directions or prosecutions where we feel that maybe Uisce Éireann aren't upgrading or prioritising supplies as we would like, or there are outstanding water quality issues that aren't being resolved over time. So the role of the EPA in the private drinking water supply side really falls into two main categories. So there's the publishing of the annual report on drinking water quality, and that really looks at the water quality in the small private supplies and the group water schemes for the previous year. And the data for the annual EDEN submission goes into that report. And then our other function is to supervise the monitoring programs of the local authorities. So that's kind of to ensure that under the regs, the correct number of supplies, the supplies are all being monitored, and there's the correct number and frequency of monitoring of each of those supplies. And we do that through our monitoring program audits. So we carried out 4 monitoring program audits last year, and we'll be doing a number of monitoring program audits this coming year as well. There are a number of points in the regs where it refers to, you should carry out this in accordance with advice provided by the EPA. So that's where our technical guidance notes really come in. So we've guidance notes on things like, how to react to or prevent an E. coli failure, um, uh, how to ensure THM compliance, and we've a number of joint position papers there as well, kind of with the HSE, in terms of some parameters and the health impacts. There's one on nitrates and nitrites, which was updated last year, and there's one on pesticides. And hopefully we'll be trying to coordinate with the HSC to have a joint position paper on THMs in the future as well. Two of the larger publications then are the EPA handbooks. So again, we've one for public water supplies and one for private water supplies. And this is really going through the regs in detail and the roles and responsibilities for both water suppliers and regulators, as set out in those regs. So you'll probably be familiar with those, but because of the new 2023 regs now, we're looking at a job of updating both of our handbooks. We'll be updating the public one first in the next couple of months, but because a lot of the information duplicates into the private one, we'll be following on then to update the private supply handbook, and we're hoping to have that done this year. We'll see how things are going, but that's our aim. In the interim then, I suppose we did want to provide a little bit of guidance on some of the monitoring frequency updates and any other updates that came with the new regs. So we updated and published our EDEN MDS guidance document. So that's the document that was sent around with this meeting invite. We've also managed to get that now on our website, so the link is there below to the updated EDEN document, and that any of the changes that have come into effect immediately as part of the new regs are reflected in that guidance note. So it's good if you haven't had a chance to get a flick through that. And the final thing then, which is slightly new as part of the 23 regs, is for the EPA to provide guidance to exempted water suppliers. But we have been doing that really. I mean, the exempted supplies typically are the household wells. And for many years now, we've had a household wells page on the EPA website. So we've kind of ticked that box already. And again, the link is there to the household wells page. There's a bit of information there about assessing any risks to your well and getting your well tested. So if anybody's interested, you can send them on to that, or I'm sure you have your own bit of guidance as well. So just a few key messages from the 2022 private supply report. The first one hasn't really changed. I suppose we're saying that the drinking water quality in private water supplies hasn't really improved in recent years. Typically, we're looking at E. coli here and THMs, and that compliance in private water supplies is below that of what you would see in public water supplies. The second point there is that the total number of small private supplies remains unknown. I suppose that's a big thing for us, that a lot of small private supplies, well, we know there are small private supplies out there that aren't registered with the local authority, and therefore they're not being monitored. I suppose that presents a risk to the communities that are using those supplies. And we're talking about things like the nursing homes and the creches and the primary schools. So they are probably more vulnerable customers in the first place. So we really want to get them registered and get them monitored. But I suppose on the upside there was an increase in the number of small private supplies that were registered. There was an increase in those that were monitored from that list. So in 2021, there was 75% of registered small private supplies monitored. And in 2022, that jumped to 84%. So that's really, really good. And again, it's protecting those vulnerable communities that are using the small private supplies. And just, I suppose we have an action box at the end of the report then. So what can water suppliers, local authorities and the Department of Housing do to help improve water quality in the private water supply sector? So initially, again, in any of our media for launching this report last year, we were really urging suppliers themselves, if they know that they have a small private supply, you know, they have their own well with to facilitate their creche or their B&B or whatever, to make contact with their local authorities proactively, and say, look, can you put me on your register, and then they'll be monitored. Then for water suppliers to carry out any infrastructural upgrades where required to comply with the water quality standards, and to protect their water quality source and address any problems, again, as soon as they arise, not to let them fester. On the local authority side then, I suppose, again, look, we were really focusing on getting this register as accurate and up to date as possible, to ensure that supplies are registered, and then that those registered supplies are monitored each year. And we were asking then, I suppose, to investigate any failures of the drinking water quality standards, and ensure that suppliers follow up on those recommendations, any recommendations that the local authorities might make, that they follow up on those to improve their treatment systems or their source protection or whatever it might be. And I suppose I might just add there, there has been a huge underspend, I suppose, on the multi-annual rural water programme, which we reported in our 2022 report as well. And it's just, if there's any way that local authorities could encourage suppliers, group water schemes, I suppose, is really who this is aimed at, to make a submission under the multi-annual water programme and use that pot of funding that's there, to invest in their supply and to improve the water quality. And the final message, I suppose, was for the Department of Housing as the policy setters. You'd probably be aware as well that there was a huge review of the rural water sector carried out recently, and a report published in January 2023. Sorry, and we were asking there for the Department of Housing to look at the key messages of that report, and action some of those key messages, I suppose, to support the rural water sector and ultimately improve water quality. So that's a bit of a tour through our report and our key functions. I'm going to hand over to Derval now, who's just going to go through, I suppose, a number of the points that we see as being important for local authorities to carry out under the new regs.
You're on mute there, Derval.
Sorry, thanks, Lisa. Thanks, Michelle. I'm going to go down to the next few slides, but I'm actually going to turn off my camera just so that you can focus on the slides as opposed to me talking. So, yeah, the local authority is responsible for the supervision and monitoring, as you know, of the private water supplies. So those supplies are supplies serving greater than 50 persons or more, or greater or equal to 10 meters cube per day. But it also the irrespective of size or volume, if the water supply has a commercial or public activity, that too falls under the remit of the local authority for monitoring and supervision. So it might be, you know, a B&B serving 2 people, or a creche serving 10 children. That would fall under a commercial activity. Or you could have, say, for example, a GAA club, which would have a well maybe linked to its clubhouse, which may form a library or a town hall, which would form a public activity. So it's not just those serving greater than 50 persons. I suppose is the message there. It can be smaller supplies, and those commercial or public activities that are small would be termed small private supplies. So the local authority also has a monitoring function under Regulation 13.3 of the drinking water regs. So the next slide then, Michelle, if I can just get you to flick on.
Joe.
Yeah, no. So the local authorities, as I said, are the supervisory authority for regulated supplies. So this table is just taken from that EDEN MDS document that Michelle mentioned that was sent around with this invite, and as she said, it's up on our website. also. So you can see there's different types of water supplies that fall under the regulated private drinking water supplies and those that fall outside the remit of the local authority. So you've the public group water schemes, they're supplies that are served from a public water supply managed by Irish Water. So they're the public group water schemes. So, and then you have the private group water schemes, small private supplies that I mentioned, and the household wells. So the supplies are regulated really depending on the number of people or the volume of water served, or if the supply has a commercial or public activity. So you see there, for example, a private group water scheme, if it has less than 50 people not supplying any public or commercial activity, it's exempt. But if it is less than 50 and it does have a commercial or public activity, it's regulated. And again, the small private supplies are those that are small, less than 50, but serving a commercial or public activity, regardless of the number of people served. And then you have the household or well or private well, that's a single house only, no commercial or public activity, they're exempt from the regulations. And Michelle had mentioned that already. So the next slide then, Michelle, that shows Regulation 14.5 of the 2023 regulations request or require the local authorities to establish a private water supply register, which records all the relevant information pertaining to each regulated private water supply that falls within the remit of the local authority. So I suppose the important point to note here is that the register, the details to be contained within that register under that regulation, they haven't changed. So they remain the same as the 2014 regs. So the local authority is required to identify and include all group water schemes and all small private supplies. And you can do that by, communicating with your planning division or reaching out to the HSE, your contacts within the HSE for your region. They may have they would have a food business register. Talk to other neighbouring local authorities to see how they capture their private water supplies. But as a priority, the local authority really should be contacting all the creches, all the schools, the nursing homes, the hotels within your area to determine if they're on a public or private water supply. Because, we found in the past, you might have a hotel that or a creche, indeed, that you believe there's a mains running outside and you believe, look, that's on a public water supply, but they may have switched to their own private water supply. And again, the onus is on the local authority, unfortunately, to find these supplies and have them on the register. And as they are the most vulnerable population, we would request that a real focus this year is on identifying those supplies. Now, we know that it's a difficult job to identify all of these small private supplies. However, these are the supplies that tend to pose the greatest risk to human health. These are the supplies that we're concerned about. They're the supplies that the HSE are concerned about. And, it may also be beneficial if the Rural Water Division is looking for extra staff to support this area, that if you have a full and complete register of supplies, that will give a clearer picture of the scale of the work and the amount of resources and funding you need to ensure that plan is carried out in accordance with the regulations. So it's a good thing to put in the work now. It could benefit in the future. And we have in there that it's updated, the register is updated frequently, and that's a requirement of the regulations. And that has a knock-on effect, which I will speak about in the next few slides, on the compliance monitoring programme, because if your population or numbers change, that affects the frequency of your monitoring. If the treatment changes, that also affects the frequency of your monitoring. And obviously, if a new supply goes on there, that requires additional monitoring. So all that should be documented on the register. And work to identify these supplies should also be documented. Even if it's just something as simple as we rang up the hotels, we Google mapped all the hotels in our area and we phoned them up to determine if they're on the register or not. Document all of that information, because that's proof that you're updating your register, or you're reviewing your register frequently. And that is something that we will be focusing on this year. We'll be focusing on the register during our monitoring programme audits, because we are concerned, I suppose, that not all supplies are on that register. So just document that, because we will be looking to see for verification to see if the register is being maintained, and new private water supplies, if they are being identified, and those where the population or volume has changed, or indeed where a supply no longer exists, you know, that's something that we will be focusing in on this year's audit. So that information in identifying it should be documented. So the next slide then, this is just an example of water supply register. So you see there on top the headings in bold. They're the items that are required under the Regulation 14.5 of the 2023 regs. So you're required to have in place the water supply name, the details of the address, the scheme code, the volume or the population, and the treatment. And those three parts are important because, again, they inform your monitoring programme and the source of the supply. So the next slide then goes into a little bit more detail on the pre-compliance monitoring programme. So what I mean by pre-compliance, at the start, before the start of every year, the local authority should be setting out what it's going to monitor for the year ahead. And the Regulation 13 sets out what should be in that monitoring programme. So all the supplies that are listed on your register should be monitored, and they should be monitored at the required frequency, dependent on, again, on the population, the volume, and the treatment of the supply. And you are to ensure the sample locations are equally distributed throughout the supply. So for the group water schemes there, we are recommending that you delineate the water supply zones so that you have your sampling points that are representative of the water supply that you're sampling. So if you have a water sampler going out, that you can give them that map and they can see the boundaries of the supply, and they know, you know, where the location is that they're supposed to be taking a sample for. Because we found in the past a non-compliance could be reported and the group water scheme will say, well, that actually isn't served by us at all. That's a private supply, a well at the, you know, at the back of a house. And if that work is validated, there's no way of deleting that from the system. It goes into the private water supply report and it's reported. So it's important at the outset to ensure that your locations are specific to the actual supply you're monitoring, and to ensure the samples are taken from the point of compliance. So Regulation 7 of the 2023 regs define that, and they state that the point of compliance is water intended for human consumption, supplied from a distribution network if it's in relation to a group water scheme, or a private source if it's related to one of those small private supplies, at the point within the premises at which it emerges from the tap normally used for human consumption. So that's typically the kitchen tap. So what we don't want is a compliant sample taken at an outside tap, you know, in a graveyard at the back of a church, a sampling kiosk, which was the case for COVID, which was fine back then, but that should no longer apply, and taps fed from header tanks, because they're not applicable to, they're not representative of water that's normally used directly from the mains for human consumption. And then when all of that work is done, to review the monitoring frequency to ensure you have no shortfalls, and to ensure that the sampling locations are valid, and that they, at the end of the year, that their next year's monitoring doesn't go back to the same sampling location again, that you change it up, to ensure that you're getting, you know, samples being taken at the cluster areas, maybe in the centre of a town, but also at the ends of the distribution network, and that you're not going back to the same point year in, year out. So the next slide there will show this is just an example of what a predetermined compliance monitoring programme looks like, or would look like. So you have your scheme name here. This is all taken from the template of the register you saw earlier with the volume and population. Now you could put in the treatment in here as well, which would be beneficial, and I'll explain why later on. So you've your annual number of Group A and Group B, and then you have the year ahead, and you see the spread there. So if we take the nursing home that's boxed in red there, it's a small supply, it serves 50 people. It has just 2 Group A and 1 Group B samples. So you can see there's a Group A sample in March and in a Group A in March and in October, and you have the Group B in June. So they're not lumped all together Q1 or the middle of the year. They're spread evenly throughout the year. It's good to do it this way because it ensures you can track progress of your sampling throughout the year, so you know you're on track to take the correct number of samples. And you know the lab is aware of what month and where it's going to be carrying out its sampling, and it ensures that at the end of the year you're not left with shortfalls. Now, we haven't shown it here, but the sample locations should also be predetermined at the start of the year as is set out in their handbook. And as I said, the same location shouldn't be chosen each time, and the handbook has more detail on how to randomly select those sample locations. So the next slide there, this is a table taken from that EDEN guidance document we mentioned, and I just want to hone in there on the population of less than 50. So in the regs, it states that for those small commercial or public activities, they should be monitored greater than 0. So our guidance is that they should be monitored twice as a Group A and once as a Group B monitoring every year. Now, that hasn't changed since our 2017 regs. This isn't something new, but it's something we find when we do go out and audit the monitoring programs of local authorities. This is where we see problems, like there might only be one Group A sample and no Group B, or there might be 2 Group A and 1 Group B, but the Group B parameters like pesticides or something might be missing from that suite of sampling. So again, we just want to focus in on those because they are the more vulnerable, riskier supplies as such. They may not have any treatment at all, and we just want to make sure that they're getting the monitoring that's required of them. So again, sorry, Michelle, if you go back to that slide, just to mention as well, our shortfall report actually, it doesn't take into account this table for the populations less than 500. So if you run your shortfall report throughout the year or towards the end of the year, those supplies, those less than 500, won't be coming up as a shortfall. So it's important to note that you shouldn't be relying on the shortfall to determine your compliance with these frequencies. Your compliance plan should set out the frequencies, and it's very important to go by your compliance monitoring program for that. Yeah, so that's all I have to say on that one. So this is just my last slide. It's the table 2 of the EDEN guidance document, and these are the Group A parameters. So the only change to this from the 2023 regs is the intestinal enterococci. That's now Group A parameter, and what it means is that it's to be monitored more frequently than it was in the past. And the other things I just want to highlight, which isn't a change, but just to mention it here, you can see there the aluminium, ammonium, iron, and nitrite. They can be monitored as a Group A or a Group B, dependent on the treatment. So this is what I meant when I was saying with the register, it's important that you know the treatment in place of the plant, because if you have, for example, for aluminium, if you have a treatment plant that has coagulation and it's using aluminium as a flocculant, you need to monitor that more frequently. You need to monitor that as a Group A parameter, not as a Group B. And if it doesn't have any coagulation, it needs to be monitored as a Group B parameter. So, for example, if it's a population of 500 or less, it's to be monitored as a Group A twice and a Group B once. So it's very important to know what the treatment is for those 4 different parameters. Now, the shortfall report, then when you're going to fill that out, it will come up as if it's monitored as a Group A, it'll come up as a Group B shortfall because it's down as a Group A and a Group B. So it's important to select why it's a shortfall, and that will probably be discussed, I think, in more detail later on in the discussion, I presume, Michelle. So yeah, so that's all I have to say on the compliance plan and program. But we do intend to do at least 4 local authority audits this year, and you'll be getting an email about that. But again, the focus will be on the register and again the compliance monitoring program at those audits. Thanks a lot.
Great, thanks very much, Derval. That was good background. We move on then, I suppose, to the bulk of the webinar today, the EDEN process. So I suppose the last task here really is to submit the monitoring data that was carried out on the regulated private water supplies to the EPA, and that's done via the EDEN system. So I have a process flow map here, just quickly. So the data is transferred from the local authority LIMS or similar system into the EDEN database. We have another program that runs behind EDEN, then Aquarius, and this is where we can capture any duplicate data or any data that's mapped against the incorrect parameter type, maybe. And if that's our first check, I suppose, on the data. And if any problems are found there, we'll go back to the local authority to delete a duplicate or map the parameter correctly. Once that's complete, then the next step is for us to undertake quality control checks on the data. And the two main ways we do that really are to run the list of supplies that had E. coli failures and supplies that didn't have adequate monitoring. So they are two Excel spreadsheets that are generated. And we'll go back out then to each local authority with those spreadsheets and just get you to confirm that the list of E. coli failures and the list of supplies not monitored is correct. I suppose that's the key kind of quality control step. So we'd ask that you put a bit of thought into that to ensure that any E. coli failures that we have listed are correct, were reported to you correctly, and that they are correct for the supply in question, and the same with supplies not monitored, that they were in fact not monitored and there's not data missing somewhere. And we do also send that data out to the National Federation of Group Water Schemes for the group water scheme side of it. And I suppose it's important just to say, after that QC step, after we've sent out those spreadsheets and they're verified by each local authority, we're assuming then that the data is correct and we're moving on to publishing it, both in our report and on the SAFER website. So after that QC step, we won't be in a position really to change any of the data. It'll be published in our report and it'll be put up on the SAFER website. So I suppose that's just a really important step to take note of in the whole submission process. And just, I suppose, a number of key items. Ensure all parameters are mapped correctly. So those kind of ones are the nitrite, the nitrate, the ammonium. I know there's different variations of those in EDEN, but just pick the one that applies to the analysis, the result that you actually have. Ensure that as Derval touched on, the aluminium or the ammonium, those ones that are treatment dependent, are mapped to either Group A or Group B, depending on the treatment in place. Ensure there's no annual shortfall. Again, like Derval touched on, our shortfall report doesn't actually look at those of a population lower than 500. So just keep a really good eye on those yourselves. Use your predetermined compliance monitoring program. We have looked into updating the shortfall based on the 2023 regs, but there's quite a complicated set of rules there, and there's a bit of a concern that if we change something in the shortfall, it'll have a knock-on effect somewhere else in the program. So we're a bit reluctant to do that. So if we can ask you please to use your predetermined monitoring program yourself to ensure there's no shortfalls. Again, I think I mentioned responding to the QC checks, and any incorrect data will end up in the report. There's quite a number of steps. There's about 6 or 7 steps to remove an incorrect data point, from EDEN to Aquarius to the maps that are in the report and the SAFER website itself. So it's quite a number of steps, and we don't adjust or amend data for the public supply report. So unfortunately, we won't be doing it going forward now for the private supply report. And I suppose I know it has been a frustration maybe for some of the group schemes, you know, they're a dot on the map and it's been published that they have had an E. coli failure when maybe they haven't actually. In reality, it was a lab error or something. So we just ask, yeah, if you can QC the data yourselves as much as possible before it's submitted to us. It's in everyone's interest, I suppose, to have it as accurate as possible. And just the final slide for me then is the shortfall reasons. There are a number of shortfall reasons pre-programmed into EDEN. I think a lot of them will capture any of the shortfall reasons that you have. If at all possible, try to avoid using other. We had used that again in previous years because of COVID, but we need to report shortfall reasons then to the European Commission after our report is published. So if we have an actual reason identified rather than other, it just helps us in that reporting process as well. So Rory, I will stop sharing then and hand over to you. Actually, sorry, I have 2 slides from your presentation, Rory. Do you want me to keep that up just for a minute?
Please, Michelle, yeah.
Yeah. So I'll hand over to Rory then, and we'll run maybe until 10 past 12, something like that, and then we'll take a break if there's a point where you feel it a natural break, Rory. That'd be great.
Lovely. Yeah.
Okay.
Okay. Hello, everybody. As Michelle said, my name is Rory, and I work on the EDEN Service Desk. So I'm probably the person you'll be in contact with if you have any queries of using MDS over the next few weeks. This morning, what I'm going to do is I'll give you an overview of the system. We'll actually step through one of our test systems, looking at the various elements. So what we'll have is look at the different user roles within the system. We'll have a look at the help facility. There's a comprehensive help facility there that's quite useful. We look at monitored entities and supplies and how we set them up. We'll upload some sample data into the system. We'll also look at approving that sample data. And we look at building data management queries so we can view the data that we've already uploaded or data we need to remove out of the system or change authorization levels. We'll then have a quick look at the shortfall report and the associated shortfall reporting reasons. And the last thing we look at is creating return year once the drinking water submission is finalized. So the first thing I'll just say is that in order to get access to the MDS system, you need to be registered on the EDEN portal. If you aren't registered, there is details on the main webpage that'll step you through the whole registration process. If you already have EDEN access, but you don't have access to the MDS module, you'll need to apply for module access. And again, there's some help documentation up on our website for that. But also you can contact EDEN at epa.ie if you need any further help on anything. Once you have been given access to the EDEN MDS system, there's 3 user roles that are available in the system. The first is the default role, and basically the default role only allows a user to upload samples into the system. You can't view data that's previously been uploaded or have a look at your shortfall reports. The second role is called uploader or downloader. Again, this lets you upload samples into the system, but it will let you view information that you've previously uploaded in the past. And the final role that we have is data manager or approver, and it basically gives you access to nearly everything within the system. It'll allow you upload your samples, it'll allow you approve samples, it'll allow you create your shortfall report, it'll allow you set up new monitored entities, approve new stations. So it's just important when you are setting up new users, you're aware of these roles and the features associated with them. What I'll do is I'm going to share my screen with you there now, and we'll have a look at the actual system itself. Okay, so Michelle, can you just confirm that you can see EDEN MDS there, please?
Should there? Yes, I can see it. Yes.
Perfect. Okay, so this is the landing page of the MDS system or monitoring data system. Once you've logged in, you'll see your menu here at the side, and that just corresponds to the graphic you saw on the previous slide showing the different roles. So for training purposes today, I have the data manager approver, so I have access to everything. The first thing I just want to draw your attention to is the help facility. So once you're in the system, if you click on help, it'll bring you into the help system. You have 3 different options. We have a table of contents, we have keyword index, and then we have a search facility. The help system is quite good. If you click on any of the options, so if we go into tutorials and data approval, you'll see here it'll give you everything to do with data approval, and if you expand in any of the menus, it'll actually step you through the process for, in this case, assigning authorization levels to sample data. If you want to search, do your keyword index, again, it's just, you can go through, select approver, and it'll give you details of what approvers are. Or alternatively, you can go in and you could do a keyword search. So if you wanted to look up schemes, and click submit, it'll pull back anything and to help reference that references the scheme keyword. Once you click on a menu option or an item, it'll bring you into that topic. And again, it's quite comprehensive, the details within it. So the first thing we'll have a look at doing is, I suppose, the start of the process is uploading data into the system. So all the data usually is collated in a LIMS system. And what you do is you export your data from your LIMS into an XML file. And once you have the XML file, you can upload it into the MDS system. So to upload a sample, log in and go to the upload. And then you click on upload data extract and you choose the file that you want to upload. So this is where you'll search for your exported XML file. Select your file and click upload. MDS, what it does is a few checks in the background to make sure the file is in the correct format, that there aren't duplicate samples or duplicate parameters within the file. If there are any errors, it'll report back an error message telling you what the errors are. But if there's no errors found, you proceed to the upload metadata screen, where you're asked to give an indication of what you would like done with this data. So we have 2 options that we suggest you select. One is EPA, and that means that when your samples are approved, you're asking the approver to mark them as an EPA return so that we can see them internally. The other option is share, and that means that if you have an agreement with maybe a neighbouring local authority, that local authority is able to view that sample data. So we put in EPA and share as the suggestion, and we can put in a comment saying the reason we're uploading. So, and if we scroll down, then we can see just an overview of what is included in it. So we can see that these are private water samples, their compliance, and there's 9 samples in total. Once you're happy with all the details, click the submit button, and you will get a message then just to say that it's been successful. You can confirm the upload has been successful by going to your filter by, changing to completed uploads. Once the system refreshes, we can see here on the 18th first file was submitted, and we can view that data if we want to just see some of the details of what was included in the file. So once the data is uploaded, then I suppose the next part of the process is really, what do we do with the data? So the first thing we really want to do is get it into the system so that it's approved and can be seen by EPA or other local authorities, or even members within your own organisation, as until it's approved, it's not visible to everybody. Only people who are data managers will be able to see it. So to approve data, what we do is we go to the data approval section. It'll show you an outline or a summary of what data is waiting to be approved. So we can select drinking water private schemes. It'll then show if there's any stations to be approved and the number of samples. What I will say is if you are approving data and you see stations required approval is greater than 1, you should really approve the stations first, because if you don't approve the stations, you won't be able to approve all the sample data. So in this case, we only have samples to approve. So if I go into samples, it'll list all the samples that were in that upload file. And again, we can see here in the upload purposes, we have these outlines or suggested authorization levels that the person uploading the samples would like to be applied to this data. So we can select one or all samples, and we have the option here that we can approve or reject. We can also download these files or these samples into a PDF file, or we can click on the results and we can actually look at the data before we approve it, just to see if we're happy with all the samples. Back to the sample, approve samples. Okay, so with sample data as well, you'll see here you have your authorization levels. So if we click EPA return and share data, we can say sample data reviewed and click approve. That sample is now approved. As you can see, it's after decreasing the number of outstanding samples by 1. There are some options as well. So instead of having to go and select each sample individually, you can go down here to these options, select all on screen, and you can approve them in bulk. Or if you want to reject a sample, you can select one, click reject, and you're asked to give a reason why. So you might say invalid results. Please report again. And a notification will be sent back to the person who uploaded these samples, asking them to re-upload the sample. So click reject. As I said, to approve a set of samples in bulk, you can select all on screen, click the approve button, and again you'll have the similar screen. So select your authorization levels, EPA, and shared data. Scroll to the bottom, click the approve button, and all these samples then will disappear. So we now know that we have no samples left to approve. Okay, and we can see again our summary has updated, showing there's no samples to be approved. I suppose one of the things we need to look at is, even maybe before we upload samples, is that we need to ensure that MDS is set up to show all the schemes or supplies that are being monitored. And in order to do that, you have to be a data manager to create new schemes. So to create a scheme, if you go to code management, go to monitored entity management, then you select the data type you have access to. So we're interested in private data. You select your return year. This is a test system, so some of the data is outdated, and click refresh. So this will list all the monitored entities that are within your local authority. You can see here that each monitored entity has a unique identifier. So if you need to set up a new monitored entity, what I would suggest is that you sort by monitored entity code. To get the last code used was 1912. So the next private scheme code that you'll need to set up is 1913. Once you know the code, click on the button Add New Monitored Entity. You can enter your code, provide a name for the monitored entity. You can add a comment, and then, as Derval mentioned, you have the details there that you must fill in. So you have your scheme source, where it's coming from, the sanitary authority, you have the treatment type. There's some details here about the population served, and it's important that the volume and population served are correct, so that when the shortfall report is being calculated, it knows what number of Group A and Group B samples should be submitted by the local authority. Once you've filled all the details in, click the Save button and your scheme is there, ready to go. So you can go and set that scheme up in your LIMS and then start creating the stations associated with that scheme in your LIMS. When you are uploading data as well, as I said, the system will give some errors. So these are just samples that we have here. So if you want to see what the details are, if you click on View Errors, it'll say there's an element has an invalid value according to its data type. So that could be that you might have reported a string or text in something that's expected as a number. So it means that you have to have a look at your file and see what the issue is with it. Some of the other errors might be a bit more obvious. Here we go, there's one. So this is an example of a new scheme that's been uploaded, 1913, but it currently doesn't exist in the system. So the system is just saying to you, you first need to set up that monitored entity or scheme, and then once the scheme is set up, you'll be able to upload your file. The next thing what I'm going to do is we'll have a look at the data management end of the system. So we've already uploaded all the data into the system. So now it's handy to be able to look at it. We can query it. We can delete data out of the system, or we can change it. For example, maybe when we uploaded the data initially, we just marked it as private data. But after reviewing it, we said, oh, it's not appearing on our shortfall report. We need to mark it as EPA return. So we can modify the authorization levels. So to query the system, if we go to data management, click start new query, we can select the data type. In this case, we only have private drinking water. We can select the local authority, click apply. The next thing we want to do is we want to put in a date range. So we can select a sample date. So if I put in apply, and I can click then view samples. Now there are other options as well that you can filter by. So you can say I want to view all monitored entities or all samples for a particular station or all samples containing a particular parameter such as enterococci. You can look at it for the date the samples were approved. What I'll do is I'll just run a general query at the moment. Oops. Sorry, put in the wrong year. Sorry, now this is a test system, so it's a bit slower. Okay. So this is the result set. You can navigate through your results by pages. So at the moment, we're only showing 20 samples per page. So you can go next, or you can jump to a particular page. You can also increase the number of items that you see in your results. So you can go and click on the drop-down list and increase the values to 20, 50, 100, or 200 records. You also have these options at the bottom of your screen to select all on screen. You can select none or invert selection. You're able to select any result and you can click view result and it'll bring you into that sample where you can see the result set of parameters. So this is showing There was 14 parameters reported as part of that sample. Again, we can download those into Excel, or we can download a PDF report. Samples. Sorry, this is just slow at loading. Okay. Back to the grid as well. You have these, I suppose, filters for different areas. So, for example, if you wanted to just look at the samples for a particular scheme or monitored entity, if you click on the drop-down list, you can go in and select all the samples. So we'd say select Davidstown National School. And instead of seeing the 306 samples, the grid will filter just showing the 2 remaining. Sorry. Let's run that query again. So again, as I said, any of those where there's a drop-down list, you can select your scheme or your station, and you can filter by those. The same here, you can filter by Group A or Group B. Down at the bottom here, we have a number of buttons, and some of these won't be available if you just have the uploader or downloader role. So to see change authorization level or to be able to delete samples, you need to be a data manager or approver. To change an authorization level, so for example, if you wanted to change this from EPA return, it should have been just marked as maybe share data. You're not ready to share it with EPA yet. What you can do is select your sample, click on change authorization level. The next screen that loads, it'll ask you what you want to set your authorization level to for this sample. So I just want to set this as shared data. I then apply the new authorization level. As you can see now, it's after changing. So instead of saying private data and EPA return, it's now just private data and shared data. And it's just important to remember when you're looking at these as well, if you see shared data and you say, I have my sample already uploaded and your shortfall report is still showing, a sample is missing, it's usually because you might have uploaded as private data and shared data, but it's not marked as EPA return. So you can go back in, select your sample when you're ready, and you can change the authorization level back to EPA return. So I mark it as EPA return. Enter our reason. And apply the authorization level. Okay. So again, here we can see now it's gone back to EPA return. The last thing we'll do just before we take a break is if you have uploaded a sample and, for example, upon review, you find actually, no, that was reported against the wrong station, or there was incorrect parameter results in it, and you want to delete it out of MDS, all you have to do is build your query, select your sample that you want to delete, click the delete button, and once you go to delete a sample, you have to enter a reason why you're deleting it. We can put in correct location. Then you need to confirm that you're going to delete the sample and that anybody who's viewed that sample or downloaded it will be notified. And then click the delete button and your sample is removed out of EDEN MDS. One thing I will say is that when you're uploading new data into EDEN MDS, it does a couple of checks, and one of the checks is it checks what the sample date is, what the sample location is, and what the sample date is. And if those three identifiers are found in the system, MDS will report that it already exists and it won't allow you upload it. But if you decide that, you review a sample and you say the results within the sample are incorrect, but the sample date, the sample code, the sample station, and the sample date remain the same, you don't have to delete it out of EDEN MDS. You can simply amend the sample in your LIMS and re-export it into MDS, get it approved, and EDEN will actually create a second revision of the sample. So if you look across in the grid here, you'll see any samples that have been uploaded, what revision version it is. So if you re-upload this first sample with different parameters, it'll create revision 2, and that's what will be reported in your shortfall report. You can view an audit, which will show you the details of the original sample, and you can view the current sample as well. So again, if you need to re-enter a sample into MDS and the sample date, the sample code, and the sample station remain the same, there's no need to delete it first. You can just re-upload the sample. And I think what we'll do is we'll take a break now at this point for 10 minutes. So we get back at about 20 past.
Perfect. Thanks very much, Rory. That's brilliant. Yeah, so if we can be back at 20 past, that would be ideal. And I did just looking at your run through, Rory, there's probably not a huge amount left on your demo bit, is there? So
no, it's really kind of just looking at the shortfall report and just a few different things to do with adding return years.
Brilliant. So we'll have plenty of time for questions still, I think. So yeah, we'll see everybody back at 20 past 12. Thanks.
Thanks.
Hi everyone. We might just give it one more minute and then we can kick off again, Rory. Okay, folks, I think we'll get ready to start again, if that's okay. Just a quick reminder for everybody that the webinar is being recorded at the moment. So if everybody could turn off their mics and turn off their cameras, and I will stop the recording at the end of Rory's session here, and we can take questions then. Okay, thanks a million.
Okay, so the last part we'll just have a look at is the shortfall report. And in order to run the shortfall report, you have to have the data manager approver role. To run the shortfall report, come back out to your main or your landing page, click the option Code Management, select Returns and Schemes Management, then click on the View Details link for the private drinking water return. And this will show you all your shortfall reports to date. So click on the Submit Return and it'll load your shortfall report for the current year. Now this lists all the schemes, the private schemes that you have still active in the system. It shows each parameter that was to be monitored, saying 2 samples were required. Only 1 sample has been reported. So you're prompted then to enter a shortfall reason. So you should select from the list of predefined options. If an option isn't there, as Michelle said, you can select other, but you have to put in a text description while you're selecting other. Click the save link and repeat that process all the way down until you come to the end of the report. When you're finished the report, click the proceed to submission, and that'll lock down your sample or your shortfall report for that year. When you're filling this in, again, if you say, okay, for this particular group or scheme, I actually have reported 2 samples, so why is it only shown 1? It's a good idea to go back, run a data management query on that scheme and just check the authorization levels to make sure that each sample has the EPA return authorization level specified. If it hasn't, that's why it's not appearing on this report. So anything that has EPA return gets included on this report. If it hasn't got that specified as an authorization level, it will lead to a shortfall in the number of samples included in the report. The other thing that you might come across is that it might have a scheme that you no longer monitor, maybe it became part of a public supply. And if that is the case, to exclude it off this report, you need to go to your monitored entity or your scheme and enter an end date. So we can go back and we can select Code Management, go to Monitored Entity Management, look for your scheme, click Refresh, and then you can click on the Edit option. And one of the last options here that we'll have is put in your scheme end date. So ideally you should put that in at the date it ended, usually the last day of the previous year. You have to enter a reason why you're putting that in. So you can say scheme became part of public water supply, and then click the save button, and that'll remove that scheme off the shortfall report as well. While we were going through this demonstration, I was working on the basis that we were looking at private supplies. But just be aware that if you're uploading public water samples, you won't be able to approve that data. That data has to be approved by Ishgaren. The same if you need a change made to a supply, either a new supply added or a supply taken off your reporting, that has to be done by Ishgaren. So you can contact your representative in that area. And I think that brings me to the end of my demonstration.
Okay, great. Thank you very much, Rory. That was really, really useful, I think, even from our point of view, to see how the data gets into EDEN, and hopefully that will help me communicate back to all of you throughout the returns process. I just have two kind of wrap-up slides really that I want to share with you. So I'll share here again. And really just reminders, I suppose, in terms of the monitoring program. Sorry, make this a little bit bigger. Sorry, folks. Sure. So just in terms of the monitoring program itself, setting out a predetermined monitoring program at the start of the year, all of the regulation.
Sorry, Michelle, you're not sharing the screen there?
Oh,
or is it?
Sorry, Lisa. Thank you for that.
There we go.
Thanks a million, Lisa. So just on the monitoring program side, I suppose ensure that all the regulated private water supplies, that be mainly the small private supplies and the group water schemes, are on the register. I know we have a few questions about that in the chat as well, so I'll get to that. Develop a predetermined monitoring program at the start of each year. I suppose that's key, really. It will help avoid any shortfalls. It will help maybe the samplers picking locations to go to obtain a sample, and just ensure that everything is on track and you have enough samples then to submit as part of the monitoring returns process. Check that the frequency of monitoring is correct for each supply, dependent on the volume or population of that supply. And make sure the sample location is served by the water supply. I suppose that's for the group schemes, really, that the sample location chosen is on the group scheme, and that it's at the consumer's tap. We have a number of help documents, I suppose, or ways that we can assist, kind of, if you're struggling with doing some of the upload process. There's the guidance document, the EDEN MDS guidance document, which has been circulated and is now on the EPA website. There's the EDEN help link that's in EDEN itself that Rory showed. And there's also the EDEN help desk email address, so eden@epa.ie, and somebody from the EDEN support team will get back to you on that. If I could just ask if participants wouldn't mind completing the post-event survey. It's only a 1-minute survey, really, just to get a bit of feedback if you found this useful or not. And finally, just a call out, I suppose, for the 2023 submission. So the data needs to be submitted same as every year, like by the 28th of February. So all the data should be submitted via EDEN no later than 28th February 2024. Any drinking water supply data should also be updated as part of that process. So if there's been a supply that has closed, a restaurant or a pub or something that's closed down, you can set an end date in EDEN for that, and it won't be pulled into your shortfall report, or any volume or population updates that need to be made through EDEN should be made as well. And I suppose just to remind everybody that after the data is, after those two spreadsheets, the E. coli failures and the list of supplies not monitored, we will send those out to each local authority. We usually give about a week to come back and confirm that those spreadsheets are correct. And after that, that's, I suppose, that's the opportunity closed to adjust the data. Any data that we have after that point will be published in our private supply report and put up on our SAFER website. But the team, myself, I'm here to help kind of with the submission. Any questions about what you should or shouldn't submit, the types of data that we're looking for, or anything at all that can't be answered from the manual, you can, I suppose, come to me on the regulation side and talk to the EDEN team on the functionality of the EDEN system, I suppose. So I think that's it, folks.